If you just increase your training volume and your body is giving you some feedback that may not be too positive, stick around. What's going on, guys? I'm Dr. Jack, owner of Vertical PT and Performance, and today we're going to be talking about how to rehab a tendon and that achy joint that may be giving you troubles with your training. So one of the first things we can do is identify what actually is involved, right? For example, if your elbow hurts because you've been doing too many pull-ups or you've been doing too many push-ups or something is angry at you, identify where most of the discomfort is, right? So, for example, if my lateral elbow right through here is hurting, that tells me it could be a possible lateral epicondylitis, tennis elbow, what have you. So what do you do to reduce that pain? So there's a few options that you have in store in reducing that discomfort. One, push into it, see what happens, right? If it gives you pretty negative feedback, you know you went too far, you know you did too much. The second best option is, after figuring out, if it is a load related issue, fire the tissues on the opposite side. Fire the tissues that support that muscle, right? So maybe that being the flexors, your bicep, your shoulder joint, everything that supports the activation and the mechanics of that muscle group. Very quickly, let's run through a couple examples on how to reduce your elbow pain. One super easy and low barriers to entry exercise for any type of tendon or elbow or joint related discomfort is isometrics. First thing you're going to do, you're going to take your hand underneath the table and drive up, try to lift that table up, And the idea is we're trying to feel it in the muscle producing that motion. It's going to be your biceps, and it's going to be your medial joint line, tendons, muscles, everything in your forearm. Movement number 2, wrist curls. So just taking your elbow out of the equation and making your wrist work really hard. Obviously, you want to use a barbell. You don't have to use a PVC with this one. Now we'll take the joint and the tissue through some range of motion. Ultimately loading the area that is not typically very happy. Boom. So the idea with all of that movement progression is to teach the tendon that it's okay to accept load, to load other tissues, and to actually put the tendon, the upset tissue, through a range of motion that is low and slow and controlled and tolerable. That way it doesn't keep stirring the pot and you're in this negative feedback cycle of discomfort with that localized pain. Hope this was helpful. Tune in for the next one, guys. Have a good day.